Senator Murkowski, I know you're very interested in the Alaska waivers, and I gave Senator Franken a little extra time. If you need it for your questioning, please take it.
Thank you, Mr. Chairman, and I appreciate the question from Senator Franken, because I do think it does go to the core of what we're trying to get to here. I pay attention very clearly to your introductory remarks as well as those of Senator Murray as the ranking, and it seems to me that there's a path forward here to get a consensus product out of this committee. That's something that I wholeheartedly endorse and embrace and have been very consistent about. And it seems that one of those pieces is what we do with the CRS and dealing with the time on that. I think we can work that through. But it's this issue of flexibility to the states that we have identified as one avenue, being through the 1332 waiver program. And I'm not sure whether or not state flexibility is being interpreted as somehow or other code for something nefarious to take place. And so I want to go back to Senator Murray's requirement here, and I think it's absolutely fair that what we're looking to do here in this committee with this targeted approach is to stabilize the individual market in this short-term period here without eroding protections and without increasing the premium costs. And as one who comes from a state with really high premium costs, even with the reductions that we've seen through the 1332, quite honestly, going from $1,000 a month to $800 a month still is no screaming deal. So this is important to me as well. I'm going to ask you, Ms. Tomczyk, as the actuary at the table, in terms of some of these proposals that have been laid out here today and last week on ways that we can better enhance the 1332 waiver, whether or not any of them actually would have a consequence, an unintended consequence of increasing premiums, whether it's the proposal for the coordination between the 1115 and the 1332, the menu of waivers, as Governor Leavitt has indicated, the budget neutrality issue, whether it's in each year or course over the course of the waiver. Can you speak to whether or not these proposals that are being discussed would have an impact on premium and premium increases?
Yes, thank you for the question. I think with any of these proposals, it may differ by state. So even things that we haven't mentioned, each state is starting from a different place in terms of whether they've expanded Medicaid, whether they have transitional policies in the market. So any proposal could have a different answer for each state, and that's, I think, where the state flexibility is beneficial, where states can look at what might work for them. But I think around overarching all of this, we still have the guardrails. So I think if any, the guardrails that are outlined in law, so if any of the proposals were found to increase the number of uninsured individuals or increase premiums, my understanding is that waiver would not be approved because it's not passing the guardrails. I think there are some other options and flexibility that could be provided that with that December 2015 guidance that I mentioned right now is maybe keeping states from looking at, where they would work to reduce premiums in aggregate and they would work to increase the number of individuals who are insured. But it's that looking at the one level down at the subpopulations that's perhaps preventing some of those things from being explored further.
But effectively, streamlining a process is not going to increase premiums.
Absolutely, yeah. Streamlining the waiver process? I don't think so.
Or allowing for a menu of standard waivers, and then to Governor Leavitt's point, you've got national standards but state solutions. Could that have potential impact to premiums? Or you're saying it depends, it's state specific?
Yeah, well, I don't think having the menu itself to help expedite and streamline the process would add to the cost, but again, depending what is on that menu, because each state is a little bit different, it could potentially pass the guardrails in one state and not another. if that makes sense. So like when we talk about reinsurance, because the way reinsurance works, it brings down premium for all. Some type of standard menu for reinsurance waivers is probably going to work for just about every state. But as we start looking at more unique and innovative, and maybe they wouldn't be on this simple menu, you know, maybe the menu has to be simple, straightforward type waivers that would work in every state. But there certainly are more innovative type waivers that may or may not work depending on the state specifics.
Well, I appreciate that, and I don't know whether anybody else had anything that they might want to add to that, but it sounds from your answer that if we're talking about some of these, basically improving on a provision that was already outlined in the ACA by making it work as intended.
Correct.
And allow for a level of efficiency is something that we should be striving for regardless of what we do. I've got, let it be
Yeah,
known for
at
the
least
record
give
that
the
everyone
states
is nodding their head.
the states the opportunity to explore that, the flexibility, yes, I agree.
Thank you. Thank you, Mr. Chairman.
Thanks.